Dr. Moench from the Utah Physicians and Healthy Environment is going to discuss why we're refuting that health study.
Thank you, Alicia. I'm Dr. Brian Moench, President of the Utah Physicians for a Healthy Environment, and I speak on behalf of our group, which is over 300 physicians and healthcare providers in the state of Utah, whose mission is to try and mitigate the public health consequences of environmental degradation. First off, I would like to thank Governor Herbert for taking a strong stand to try and eliminate wood smoke as a contributor to our overall serious air pollution problem. That's a bold and progressive move, and we applaud him for it. People who burn wood in their homes and the wood smoke goes up their chimneys are actually causing a serious contamination problem for their entire neighborhood, regardless of what the community air pollution levels are. You can think of it as someone burning wood in their own home is creating their own mini Stericycle in their own neighborhood. Which brings me to why we're here, Stericycle. I'd like to read to you the response from our physicians group to the health study, the Stericycle and Cancer study that the media was appraised of 2 days ago. We do not question the motives or the competency of those who did the study, but we do sharply disagree with the conclusions that were drawn and how this study can be interpreted. Any characterization that this in some way scientifically exonerates Stericycle is inappropriate, unsubstantiated by the evidence, and nothing changes regarding the legitimacy of the effort by these citizens to close the incinerator. In short, the health department apparently has misinterpreted their own data. To begin with, there is no health issue that has ever been studied where every study has shown the same result. Even universally accepted medical dictums, like smoking causes cancer, were eventually established not because every study ever done proved that, but because the overwhelming majority of scientific studies, thousands of them, the totality of the evidence supported those conclusions. Likewise, the issue of whether or not incinerators are health hazards, be they medical, municipal, or any other type, is not settled by one study or even a few studies, but by the preponderance of the evidence. The preponderance of the evidence from the entire body of worldwide medical research is that incinerators are health hazards for the environment and public health in general, but especially for those people that live nearby. That is why there are international nonprofit organizations whose entire mission is to close down medical waste incinerators. That is why several entire countries have banned medical waste incineration. This body of research is sufficiently robust to have precipitated a nationwide citizen movement with the help of the EPA to have these facilities closed. In fact, during the last 15 years, 98% of the over 2,300 medical waste incinerators have been closed. When the governor announced his own homegrown study of Stericycle, we were perplexed about why all this enormous body of medical evidence wasn't good enough for decision making. We are still wondering that today. The Utah Stericycle Cancer study announced yesterday does not change that debate in any way. Last fall at a press conference, we shared information on a few of thousands of studies, hundreds of studies specifically, but thousands of studies on pollution in general that have shown health hazards to entire communities from incinerators. Large studies have shown higher rates of adult and childhood cancers and birth defects among people who live around incinerators. Those results are consistent with being causative, and I will only mention two of them today. A study of 14 million people, several times the entire population of the state of Utah, followed for 13 years, revealed an increase in cancer deaths of 11,000 people among those that lived within 7.5 kilometers of an incinerator. Children living within a 5-kilometer radius of an incinerator had a doubling of their risk of cancer. A study of over 21,000 pregnant women was just published, evaluating populations surrounding 8 municipal incinerators. And here's a note, municipal incinerators are not as toxic as medical waste incinerators. The researchers demonstrated a 30% increase in preterm births among pregnant women exposed to the most incinerator emissions. The authors concluded, quote, maternal exposure to incinerator emissions, even at very low levels, was associated with preterm delivery. Stericycle is permitted to annually emit 9.5 tons of the most deadly toxic compounds known to science: dioxins, furans, benzene, heavy metals like lead and mercury. Now, to put that in context, that is as much as those types of compounds as is emitted from a full-sized oil refinery. No one would dispute that an oil refinery is a health hazard, and the shorter smokestack of Stericycle increases the exposure to the immediate neighborhood. Many of these compounds persist in the environment for years, and in many cases indefinitely, and then they bioaccumulate so that a person's own internal concentration steadily increases over time. So a more appropriate statistic is Stericycle has emitted into the community 250 tons of the most poisonous compounds that we know of over 25 years. It has become increasingly recognized by the medical community that for many of these compounds, like lead, for example, there is no safe level of exposure, so declared by our CDC and by the American Academy of Pediatrics. All of these compounds have been shown to, or are highly suspected of, precipitating serious adverse health outcomes, including cancer, birth defects, impaired intellect, multiple types of adverse pregnancy outcomes, reproductive disorders, and immune disorders. There is simply no way to justify showering our city with tons of known poisons for no benefit, especially when there are cleaner, safer, and cheaper alternatives for medical waste incineration. The possibility of the spread of pathogens by Stericycle's emissions are frequently left out of the discussion and were certainly not addressed in any way by this study. For example, live bacteria has been cultured in the ash and the chimneys of incinerators that reach the same temperatures as Stericycle. It is likely that antibiotic-resistant bacteria like MRSA is present in Stericycle's air emissions and ash. Furthermore, it is almost certain that prions, the highly infectious agents that cause fatal spongiform encephalopathy or human mad cow disease, are also present in Stericycle's emissions, and of course that was not part of this study. Now, a few specific critiques of the Utah Stericycle Cancer study are in order. Detailed questions about lifestyle showed that the Stericycle exposed population almost across the board had a lower socioeconomic and lifestyle risk than the control group, which was the rest of the state. For example, the rate of smoking was over 50% higher in the statewide control group than in the Stericycle group. From that important characteristic alone, one would have expected lower cancer rates in the Stericycle group, but that certainly was not found. Using the rest of the state as a control group is a problem because 80% of the population lives along the Wasatch Front, where other environmental factors such as our air pollution in general could be expected to obscure the differences, as well as the fact that Stericycle's emissions certainly extend far beyond the study area. The most adjacent neighborhood, Foxborough, should have been studied separately by itself as well, because the area that was studied is a much larger area and more likely to have impacts obscured by other sources of pollution like the refineries and the freeways. Most solid cancers take several decades to develop. Stericycle has only been in operation for about 24 years, and the neighborhoods were not built nearby until about 10 years ago. This kind of investigation done by the state will be incomplete and therefore inconclusive for decades into the future. Nonetheless, This study revealed increased rates of 7 of 42 cancers: colon, rectal, bone and joint, melanoma, breast, brain, and prostate cancers. A truly bewildering statement was made by the presenters from the health department that these types of cancers, quote, were highly preventable through lifestyle choices and regular health screenings. No links to air, water, or soil have ever been established. Well, let me correct the health department on this. Cancers are not ever preventable by screenings. They are detectable, but they are not preventable by screenings. And there is a huge clinical difference. More importantly, some general comments about cancer and the environment are in order. If one considers environmental exposures as contaminants in food, water, soil, and air, and this would include smoking because that would be considered environmental exposure, the World Health Organization considers 80 to 90% of cancer as environmentally caused, as opposed to genetic, the other main category. The WHO recently declared air pollution as a carcinogen, a more important source of cancer than secondhand cigarette smoke, and the most important environmental carcinogen. So for the health department to say that these types of cancer have no environmental link is simply false. More specifically, the following cancers have been shown to be correlated with air pollution: lung, cervical, brain, stomach, germ cell tumors, leukemias, prostate cancer, breast cancer, and retinoblastomas, i.e. cancers of the eye. Now, a special mention needs to be made about colorectal cancer. A person who has a disease category called inflammatory bowel disease has a rate of cancer or a risk of having bowel cancer 6 times greater than the regular population. There are now 4 studies that show people exposed to more air pollution have higher rates of inflammatory bowel disease. So from the simple equation, if A equals B and B equals C, then A equals C. So for our health department to say there's no correlation between colorectal cancer and pollution is simply, utterly, medically indefensible. In addition to being wrong, I hope that the health department understands that their statement, quote, these types of cancers are highly preventable through better lifestyle choices, is deeply offensive to victims of those types of cancer. I'm one of those victims, as are 7 of my immediate family members. None of us have made poor lifestyle or high-risk choices, and we find that comment scientifically absurd and personally offensive, as do hundreds of people who are victims of those kinds of cancers who have said, what in the world is the health department trying to perpetrate? Cancer is but one of many adverse health outcomes known to be caused by environmental contaminants and waste incinerators in particular. This study obviously addresses none of those. Of all those non-cancer health outcomes, autism deserves special mention. Utah has the highest rates of autism in the nation, double the national average. Current medical literature strongly suggests that most causes of autism result from a combination of genetic susceptibility and environmental exposures. At the top of the list of environmental triggers are heavy metals. Stericycle smoke is a heavy metal and neurotoxin factory. For our state government, including the health department, to ignore our alarming autism epidemic and then to not even consider the possible connection between Stericycle smokestack and autism is unconscionable and a clear dereliction of their duty to protect public health. To summarize, this study was mischaracterized by some in the media as a clean bill of health for Stericycle. The health department authors drew conclusions from this study that are entirely unwarranted. The governor has no basis for preferentially using this study for policymaking while ignoring a much vaster body of research that contradicts it. And for those of you who are interested, I have several pages of medical studies that show the relationship between environmental exposures and Cancer. Thank you.